Willkommen, bienvenue, and welcome to our conversation on setting well-being as the North Star. We're excited to have you all join us today for an expert panel conversation on prioritizing equitable well-being. My name is Chantel Stewart, and I will be your MC for today's conversation. I'm also your friendly neighborhood tech enthusiast, so if during this webinar you have any technical difficulties, please chat me directly so that I may be able to help. We'd like for this to be more of a discussion, so as you have questions or comments, please type them into the chat box and we'll get to as many of them as we can. If you have questions for a specific panelist, please be sure to include their name in the chat. Also, Zoom has recently added a new accessibility feature. You should see an icon for live transcripts at the bottom of your Zoom window. If you click into that and choose the bottom link, Enable Auto Transcription, Zoom will, with varying success, transcribe audio from this session in real time. I'm also your friendly neighborhood tech, going back to the previous slide. We encourage you to live tweet if you'd like, using the hashtags Power of Voice, hashtag Wellbeing, and please be sure to tag and follow us at MetGroup. Thank you so much for joining us, and we're excited to get this started. Next, I'd like to introduce you to our moderator for today's event, Eric Friedenwald Fishman.
Hi, everyone. I'm Eric Friedenwald Fishman. I'm the creative director here and founder of Metropolitan Group, and I'm thrilled that you're all here. And while we're in the same virtual room, the actual here for most of us is different today. So I want to start by acknowledging the here where I am today, and with respect and recognition for those who first walked and traded and gathered in this area of convergence of rivers and people. Today, I'm in Portland, Oregon, which is the traditional homeland of the Clackamas, Chinook, Willamette, Tumwater, Multnomah, Wasco, Wishram, and other Chinook peoples, as well as the Tualatin, Kalapuya, Molalla, Cayuse, Warm Springs, and Yakima nations. Our work begins with this acknowledgement, but it needs to continue with actions to elevate Indigenous narratives and to recognize Indigenous contributions. And I encourage everyone to take a moment and share an acknowledgement in the chat of the Native and Indigenous peoples on whose homelands you are on today. We're joined in today's conversations with grassroots organizers, researchers, public sector, nonprofit, philanthropic, and private sector change agents and colleagues from across the United States, from Mexico, from Canada, and Australia, just to name a few that I was able to discern from who signed up. And today we're going to hear brief perspectives from each of our four panelists, whom I'll introduce in just a few minutes. And then we'll take some time for them to have a conversation sparked by what they've heard from each other, and then open up for questions from everyone who's joined this conversation. Please remember at any time to put your questions in the chat, and if it's for a specific panelist, to add their name. So let me kick us off by saying, why well-being? Why are we here having this discussion? Well, in the last 15 months, what's been true for way too long and clear to anyone who is willing to see it has now been spotlighted for everyone. It's not hard to see the deep inequities, the disconnected silos that impede systemic solutions, and the widely accepted paradigms and mindsets and normative expectations of societal purpose and progress that exacerbate disparity, that advance ill-being and intergenerational burdening while masking inequities and obfuscating the warning signals of our shared perils. Whether our work on this call focuses on climate change, the food system, public health, educational equity, if we work on living wages, justice system transformation, safe and affordable housing, environmental justice, and all of them impacted by systemic racism, at the core of all of these concerns is the dominant definition of progress and societal and institutional purpose that defines how we see problems, what solutions are even considered, and how we make decisions. And the current construct that we all live in centers on economic growth, consumption, and competition. And this paradigm is not accidental. It's been carefully constructed to concentrate and to protect power and wealth. It masks inequity, and where it's unmasked, it normalizes and justifies severe inequities. You can have great GDP growth and at the same time have dramatic inequity. Let's just take a quick look at the United States today. The top 1% of wealth in the United States of the population controls 30% of the national wealth, while the bottom 50% of income bracket population controls a total of 1% of the wealth in the nation. This dominant construct we're living in is grounded in and aided by systemic racism. It creates and reinforces divides. It creates and reinforces siloed thinking and systems and community expectations that block solidarity and cost all of us dearly. It bolsters false constructs of trade-offs, environment and economy, between equity and stability, between punitive law enforcement and safety, between living wages and profitability, and so many other distracting binary frames. And this approach is accepted by many as gospel, as immutable, as the way things are and the way things work. And thus it drives how the vast majority of our systems and decision-making is structured. It locks us into zero-sum thinking, to this idea that for me to do well, someone else must be oppressed and resources must be extracted. And there's a growing and dispersed movement around the world to counter this construct. And that movement is driving a shift in how we define progress at a societal level and how we define purpose, and is moving to centering it on equitable well-being. And when we're talking about the well-being approach, we're not talking about another word for healthcare, wellness, mindfulness, or whole health. We are talking about a shift in how we define progress to one that centers shared and equitable human and planetary well-being as the heart and driver of decision-making. The work that's being done on a well-being approach around the world certainly includes access to healthcare, enhanced health equity, but it also means access to civic life and freedom in the public square. It means shifting the norm to a level of livelihood based upon people's work that is flourishing and sustainable. It means making as normative access to clean water, clean air, and clean food. It means engaging with our national systems and to sustainably meet the resources, the ecoservices, and biodiversity, as well as the natural wonder and wild places needs of our current, but also future generations. It means establishing a norm where every community is protected from toxins because the choices we make about how we produce, distribute, use, and manage everything are made with a well-being lens. It means that systems of community safety and justice deliver on all of us being more safe and all of us being able to authentically trust justice. The decisions we make if our North Star is equitable well-being remove silos and will redesign structures. We will see assets in places where now we only see deficits. We will change how decisions are made and by whom. We will be open to new solutions, and we will expect equitable outcomes because the way things are will have fundamentally changed. Our speakers today will share their perspectives and learnings about the need and opportunity to make this shift, the changes we face in to do so, the challenges we need to overcome, changes that are being made and changes that need to be made, and mainly questions that need to be explored. Today is not about having the answers or prescribing a specific set of solutions, but rather is about sparking thinking, ideas, questions, sparking experimentation, and building currency for shifting the core concept of progress and purpose. All of us will hopefully play a role in engaging diverse fields, coalitions, movements, thinkers, and activists in questioning and redefining the constructs of purpose in ways that open possibility for a far more just, equitable, and sustainable world. And I'm really excited for us now to dig into this conversation and learn more from each other. So let me do a quick introduction of our four panelists. We have with us Mindy Fullilove. She's a professor of urban policy and health at the New School. She's the author of Main Street and of other books that explore the connection between place and well-being. We're joined by Alonzo Plow. He's the Robert Wood Johnson Foundation's Chief Science Officer. He's their VP of Research, Evaluation, and Learning, and an expansive thinker who looks for new ideas and brings them to the table. We're joined by Julie Rusk, who's the founder of Civic Wellbeing Partners, a startup to advance wellbeing leadership practices based on her work as the architect of the City of Santa Monica's award-winning wellbeing approach. And by Jennifer Messenger, who leads Metropolitan Group's public health practice. She researches, designs, and tests narratives and message framing to drive social impact. So without further ado, let's dig into the conversation. Mindy, would you kick us off by sharing some of your thinking?
Thanks, Eric. I'm delighted to. I've really been pondering recently, it's sort of a year into COVID, a question which is, given 25 years of work on cities and creating a model of how I thought cities connected to health in the big sense, in the sense of well-being, I thought, how well did my model predict what we saw in COVID, and where did it fall apart? And this was an interesting exercise. And my research, is situated in Harlem and other inner city communities, and saw a whole series of pandemics. So watched the AIDS epidemic, the violence epidemic, the crack epidemic, and have been able to locate these policies these processes, these epidemic processes in the policies that federal, state, and local governments were unfurling, especially on poor and vulnerable communities, including urban renewal and plant shrinkage and disinvestment and gentrification. And so watching and documenting the ways in which these policies ripped communities apart, scattered and impoverished residents, and left them terribly vulnerable. And therefore, it was very clear to me when COVID struck that it would fall unequally on these segments of the population, and that the most vulnerable were vulnerable because of overcrowded housing, they were vulnerable because of their jobs, and they were vulnerable because of their poverty. All of that played out exactly as I thought it would. But what I really didn't expect, and what really shocked me, the times when I was screaming at the headlines of the newspaper, was the ways in which the callous treatment of the pandemic was exposing all of the healthcare workers at every level to this infectious disease, and not responding quickly to give them any kind of protection, sort of simple basic masks and gloves. That shocked me, and that we hadn't stockpiled those things shocked me. In my archive, I have a headline from 2004. Health experts say we're ill prepared for a future disaster. So 2004, people are saying we got to get ready. It's not like we didn't know this was coming. Nobody can say that. We knew something like this could come, and we should have been prepared. But the depletion of the stocks shocked me, and it wasn't in my model. There was a very important report in Lancet from David Himmelstein, Steffi Wohlhandler, Mary Bassett, and others. And they looked at 4 years of the Trump administration, 40 years of neoliberal policies, and 400 years of inequality. And I think it was that 40 years of neoliberalism that I had not accurately understood the ways in which the concentration of wealth had worked. How did they get all that wealth to the people at the top? It was partly by taking it from the commons. And therefore, things like stockpiles had not been kept up. Parks had not been kept up. Water pipes had not been kept up. So all the things that we hold in common that make our society function as a collective, including the spirit of the collective, these had been brushed aside in the pursuit of profit. And that was what I underestimated in my model. And I think that that's at the structural level that we have to really understand that neoliberalism isn't just a term, it's a set of practices. And it's a set of practices that are inherently an obstacle to well-being of the whole population. So I want to put that on the table as something that I've learned in my reflections about what's happened over the past year. And I think I'm to pass it to Alonzo.
Thank you, Mindy. Alonzo, please carry us forward.
You do what one has to always do, search for unmuting as many times and many hours as I spend on this device. Well, really great to be with everybody today. And I'll just, again, certainly through the window of the many events kind of culminating in 2020 and 2021, events including COVID, but also particularly including the murder, police murders on the streets. A lot of things surfaced dramatically in 2020 that had long gestation periods, and as Mindy described, a long gestation period in this country where notions of collectivity and well-being were just not the driving forces of the founding of the nation, the institutional structures that developed, just the opposite. And so we as a foundation, as Robert Wood Johnson Foundation, trying to think about how to promote health and well-being in this country, and figure out how we can really move past being captured by, in the healthcare, I'll just stay with the healthcare system as an institution whose operating principles and even its data implicitly carry some of the same baggage of structural racism in their constructs and operations. How do we counter this? How do we develop a counter narrative that allows us to have a more equitable society and actually think about well-being. So we have, as a foundation, begun to think about this again in an exploratory but more systematic way over the last few years. Really enhanced by many people on who I can see who are on this Zoom conference, our colleagues from around the world who were part of a learning session for us a couple of years ago in Italy, where we drew on collective experience of many people to think about how we could bring and be a catalyst for well-being thinking around health in the United States. And we are on that course, still learning, but dedicated to that. And so we are really thinking about, again, how the well-being as a construct can help us develop a narrative, a mindset, and actions that really drive our thinking around health in a more collectivist, community-driven ways to counter exactly some of the outcomes that Mindy just talked about. Because those outcomes were the default outcomes that happen from a system that is not aligned toward collective action, linkage to communities and narratives of sustainability, sustenance, and equity. So we are looking at that and looking at it in a number of different ways. And I'll just mention, to stay within my 4-minute window here, we really want to think about well-being in a couple of different ways, drawing on the extensive literature on individual well-being and happiness determinants that is around the world, but really focus on what does it mean to promote community well-being? What does it mean to promote civic well-being? What does it mean to move our indicators of health from essentially disease outcomes to measures of thriving and flourishing? And how can we have a set of national health indicators that more fully embrace broader notions of well-being, positive health, so that those can therefore be incorporated into principles, practices, laws, governance structures that take this broader collectivist approach and can more systematically help to dismantle the tacit encumbrances of structural racism. So again, we see the well-being thinking as part of narrative change. How can communities be catalysts for this kind of narrative change? How can we have meaningful measures and metrics and that push that awareness at a local level? How can we change the entire national construct for what is health information, so that well-being measures are and respect to equity are more prominent? And we're in the Q&A, I'll talk more about a national program commission to transform health data that will be launching soon. And what would that mean if the future of our public, meaning shared data on health, embraced well-being frameworks, well-being and positive health metrics? What would it have looked like if we had been tracking well-being and positive health instead of waiting for the health outcomes of despair characterized by our opioid epidemic? So let me just stop there and hope we can pick up some more of this in the Q&A.
Thank you, Alonzo. Julia, I'm going to pass it to you because you've been doing work on this in a city context. So let's get you into the conversation.
Well, thank you. It's really great to be here. And I'm just really reflecting on the opportunity to come together with people all over the country and the world online and really make meaning out of this last year. And I think piggybacking on the comments of Mindy and Alonzo, we've really all had this front row seat to see the effects of years and years of, I'm afraid, design. And I think that what we are really all together reflecting on is, as we sort of move into spring and we come back in person and we really think about smart action, do we just revert to some business as usual and try and kind of get back on the horse like we've always ridden it? Or do we see this as a real moment to call us to a different North Star? And I really liked the way the Met Group talked about well-being as a North Star, because I think it is something very aspirational and big. And as somebody who's coming to you from California, I want to start off by saying well-being is not about lattes and yoga mats. And I think we do have a language problem, so I just want to put a pin in that. It is about justice. It is a first principle, and I think needs to be understood and defined in that way, because really coming from the perspective of place and community and our own lives, I think if there's nothing else that we've, I hope, all taken away from the experience of the last year, it's simply about how interconnected we are. And there's just no denying that. So whether it's the interconnections of a virus that has just rammed into our lives and changed completely, upended how we've done things, or whether it's really like watching horrific images on the screen that maybe many of us knew about, had been working on, but didn't really take in the sort of the veracity and the pain and the sort of continual just chipping away that we've done in communities and people in our systems have done. And frankly, how we've really asked our schools, our law enforcement agencies to sort of clean up and deal with things that we've just completely mishandled. I mean, I think these are big issues. So I guess my first point is to say we're talking about serious business here when we're talking about well-being, and we're really talking about the interconnections that both make us human and also the interconnections and the practices and the investments that we make in our systems. And you know, to me, as somebody who's spent my adult career really trying to make good on the promise of what government can do, and in my case, local government, you know, there's a lot to reckon with, because while in places like Santa Monica, where we have the opportunity to use our resources, which are significant, and put that together with needs that are also significant. I come to you from a community that many of you may not know, but you know, we're not simply a People magazine cutout. We have real people who are struggling. 70% of the people who live in this community are renters. People are afraid. They've continued to be afraid, and yet they have strengths and assets that if we as government leaders and NGO leaders and researchers don't really kind of pay proper attention to the assets and the strengths of our communities, as well as the disparities and the needs, we're just missing the boat. So, you know, so where do we go from here, and what does that really mean? I feel increasingly clear and committed that we cannot think about well-being or a construct of well-being if we don't absolutely pair it and center it with the racial equity movement. And in fact, I'd say that the racial equity movement leads, and those of us working on things like a well-being economy, those of us working on things like changes in our healthcare system, absolutely have to really make sure that we're articulating and understanding what that means. I would say that one of the bright spots that I'm seeing is as people are emerging from this last year, many are looking so clearly at what do we need to do differently. So just this week, in my own experience, I had the opportunity to sit with a group of people in rural Vermont who are on a commission that are really looking at how can we change some of our traditional recreation and parks activities to bring a well-being lens to it, and how is it paired with racial equity, and how do we look at the transportation and access issues and the disparities. I sat with a group of people in Charlotte, North Carolina, where a county supervisor is really leading an effort there to look at what would a well-being index not only look like, what would it measure, but most importantly, what would it do? So I I feel that we really are at this moment where we all have such a great opportunity to kind of move forward boldly, but also with humility to listen and learn from each other. The fact that we can be connected with people on other parts of the world is just an amazing thing. And I'd say for those of us in the US, that humility is particularly important as we kind of look across the pond to what's happening in the UK. There's many really positive initiatives. And so I look forward to kind of getting into those specifics, but I'm delighted to be here with you all today. Thank you.
Thank you. And thank you for teeing up some of those examples that we can get into later. Jennifer, several folks have talked about the narrative that is holding up where we currently are and where we're going. Love to hear your perspective.
Thanks, Eric. I was thinking about these shifts that Mindy and Alonzo and Julie are describing in terms of social priorities and measures and policies really require people to see a problem with the status quo. And one of the big obstacles here is that the dominant narrative, as Eric said earlier, about progress and power in the US and many other places is really firmly rooted in wealth, consumption, and competition. And so for many people and institutions, the strength of our economy is the strength of our country. So as Eric said, this really narrow narrative reinforces consumption and wealth. It reinforces competition over collaboration, individualism and deservingness, and really zero-sum thinking. If you do better, I do worse. So one level set I want to make on terms as we're talking about narratives, just so we're all on the same page. Metropolitan Group defines narratives as the collection of stories and experiences that work together as a system to convey an interpretation of the world and how it works. So it's the things we hear, the things we read, the things we see, the things we experience, and the story that creates in our mind that helps us filter information. They influence how we make sense of things, how we define our priorities, how we justify or change our decisions. And those narratives are built over time, sometimes organically, often created and sustained by a dominant group in order to establish and maintain power. And so this economic and growth focused narrative is reinforced all the time by the marketplace, by policy framing, by political speech, by news and entertainment media. Every morning when I listen to the news highlights and the first thing I hear is the stock market report, I think, where are the other indicators of how we're doing? Why is that the only thing that we use to gauge how the country is and how people are doing day to day? And so when that narrative is so deeply embedded, it really shapes our mindsets and our actions, everything from our own individual behaviors, how we make decisions, how we vote, how we spend money, how we invest in community, how we use our time, to community expectations, to national policy. So we've done a lot of thinking about what would an alternative narrative look like. And put simply, and not wordsmithed or tested, it's probably something like this. What matters the most, how we will know we're making progress as people and a nation, is that people are doing well and they're creating the futures they want. And we have equitable well-being for everyone. Now, to Julie's comment about the language problem, defining well-being is a big piece in this puzzle. So it encompasses all the things that we've been talking about here, including economic stability and sustainable growth, and also health, connectivity, civic engagement, purpose, many other factors. There is a nascent movement that we're studying around the world and in the US to shift the narrative of progress from pure economics to a more holistic idea of well-being. There are groups here in the US and around the world, some of whom are in this Zoom room with us, who are starting to experiment with new narratives, both formally and informally. But as far as we're seeing, the movement is not centralized or organized. Often these efforts also take kind of a kinder, gentler economy approach. So we need an economy that delivers good, meaningful lives for everyone, an economy for life, a prosperity economy, a solidarity economy. But it's not a complete reframe as far as we're seeing to well-being. And so even by calling economy to mind, we think that's reinforcing zero-sum thinking and values of individual responsibility, consumption, and growth. So how many of you have heard things in your work like, investing in early childhood education means we'll get better health and learning outcomes, stronger families, more civic connection? But prove to me that we'll spend less on prisons and remedial education and the costs will go down, now I'm with you. Like, that's a hard paradigm to get out of. To be certain, there are also well-being stories and narratives coming strongly from the grassroots, both individually and collectively, but there just hasn't been the funding or organizing support or research and testing to bring those together in a crescendo or to test which narratives really most effectively shift mindsets and actions. COVID-19 has come up several times in our conversation. And the conversation about COVID prevention, vaccines has been a little bit of a laboratory about narratives. So in the early days, this kind of remarkable thing happened where the narrative was health is more important than anything. And we saw actions following that. But that narrative started to strain as soon as the economy started to falter, and very quickly moved into a trade-offs conversation about balancing being safe with saving our economy. And those have been framed as two different choices rather than one well-being option. So we see a huge opportunity here to collectively counter that dominant growth narrative, to learn from the grassroots movements that already hold well-being narratives and knowledge and wisdom and capital, and to explore and co-create a new narrative centered on well-being. And I'm really eager to talk about that with our panelists and with all of you on the call.
Thank you, all of you. Just what great thoughts to get us going. And would love to kick off the conversation between the four of you. Each of you hit on this concept in one way, shape, or form of the commons, and of how there's been an extraction from the commons, a move away from, or a lack of ever putting in place a prioritization around public goods, commons goods, collective benefit. And I would just love to hear you have a conversation about where are the places where we've missed that, and are there any bright spots where we've seen that different approach happening? And I don't know, Mindy, you were the first one that brought up this idea of the cost has come out of the commons. So maybe you can remind us of that frame and talk about where you've seen it coming out, or any examples of where you could see it being different.
It's such an important piece of the puzzle of well-being. As a social psychiatrist, the way we look at the world is that the social connections among us are what keep us healthy. And those social connections among us are made in the commons. That's how we connect to each other. So the commons are the libraries, the parks, the main streets, the schools, all of that we share and that we pay for with our common money. But it also includes stockpiling things we might need in a disaster. There's going to be disasters. We're going to need stuff, putting it in a stockpile. That's also part of creating the commons. And having decent pipes for our water, figuring out what we're going to do with our garbage, taking care of our bridges. All of that is the work of the commons. And that work requires that we have a sense that we are people with something in common. And that's that sense of solidarity. But sadly, as Jennifer was describing about this, lose-lose situation that we're in, I can only get rich if you get poor. What we have done is the top dogs have taken all the money and stripped all the commons. So our bridges are in terrible shape, our tunnels are in terrible shape, our parks are in terrible shape, our libraries. So this is the commons, and our commons is very weak, and we are weak as a nation. We are not on a path to well-being. We are on a path to, a dog-eat-dog path. It's not pretty, and it can't save us. So that's like I think a central obstacle to the kind of well-being that we would like to see.
Yeah, I'll just jump in, and I don't want to be the negative force in this one, but it's so wonderful to have a global conversation here, because we had a common, we experienced a common disaster during COVID. And I'm a public health guy. I was trying to think about when was the last time we globally experienced a common disaster. It's been a while. But we had a very different experiences related to drawing on a sense of community and collectivity versus places that didn't have one. And as Mindy talked about, this country and our COVID response was a constant battle back and forth between notions of what we do for the collective to ensure all of our health versus retreating to individualist kinds of perspectives, more concerned with individual freedom and collective well-being. And again, it is a challenge to see that our collective well-being depends on a vibrant commons and an understanding that in any societal sense, individual well-being is entirely ultimately dependent on decisions beyond the individual. But I think the narrative change, again, I'll shift to my optimistic frame a little bit, because I've been doing a lot of media work, a lot of interviews with the press about COVID. There are examples of COVID demonstrating that we're all in this together, particularly in communities that have grappled with it successfully, connected with community leaders at a grassroots level, and done quite well with their communities. We have some leading COVID responses by some of the most hard-hit communities in the nation, and those are the indigenous communities, who have banded together and really responded well and also been negatively affected the most. So again, many lessons to it, but it is an uphill battle to substitute the narrative that we're trying to, though I think some of the roots of the failure of the default narrative is in COVID. And I think, I think about paradigm shifting in the formal sense of how that happens. Paradigms shift when your assumed reality is so fragile and not holding together that you're forced to come up with another construct. That's kind of the way science deals with anomaly. You just can't explain things in the old way anymore. This lack of having a collective spirit is really an anomaly if we're going to have societal well-being, and we need to get past that, and we need a different narrative. And I think it needs to be expressed with that urgency, because what we've seen is a tragic anomaly that needs to be rectified.
I'm struck by the, oh, sorry, Julie, do you want to go?
No, go ahead, Jennifer, please.
The metaphor of the stockpile, Mindy, I think is really interesting from a narrative perspective, right? Like this collective stockpile, the way we're building something that will look out for all of us collectively, I think is something really interesting to play with, the shared experience. I'm watching Sabrina, hi Sabrina, in the chat, your comments about both vilification of government, being used to gut the idea of a commons and some shared responsibility and investment in a commons, but also the stories that tell the value of the individual over the collective. And some of the work that is coming out of Robert Wood Johnson Foundation on studying narratives is testing that, like where even in entertainment media do we constantly tell the individual hero story versus any kind of collective story, right? That centers what's happening in the community as the villain or the hero, if you will, over an individual. So I think that the narrative, I think there's opportunity in the narrative about the commons. I've been really intrigued by a couple of the most shared articles in the New York Times have been the one on languishing a couple of weeks ago, and then the one on flourishing in the last couple of days. If you haven't seen them, they're super interesting, both for personal healing and for collective thinking. But so much of that is about community connection and how people across the country are languishing because we are isolated from community and we don't have that connection. And especially when you look at Indigenous communities, Latinx communities, Black and African American communities, the value of connection, the sustaining resilience of connection. How do we restore that as a collective? And maybe that's a pathway coming out of COVID, right? How do we rebuild that stockpile, the physical, literal stockpile, Mindy, of stuff and supplies to get through a pandemic, and also the stockpile of relationships and community that can move us forward?
Yeah, one of the things I've been reflecting on recently is the power of peer groups, mutual aid networks, and really what that looks like as sort of the connective tissue. And, a lot of the focus we tend to put on systems change or individual, and it's this sort of either or. And I'm really noticing that when people come together with in a place or around a shared issue and really support each other and both see the need to do sort of individual work, there's sort of there is an inside job for us as human beings. And I think it's really important to stay focused in many ways on collective well-being and community well-being and the commons. And I think there's a reality that there's a lot of brokenness that we're kind of trying to build out of. And I think that some of the ways that we can support and lift up and really understand the value of a whole range of sort of organically built and very powerfully focused grassroots networks is really important. And kind of another thing I've really been noticing that I think is so important when it comes to the voice and the presence of young people is that there seems to be a much more intuitive understanding that we kind of can't take care of the world if we don't take care of ourselves and each other. And I think there's something about redefining what kind of the inside job of a more personal well-being or more sort of the social emotional development of us as human beings and how that ties to our interconnectedness and our systems. That's a very important part of all of this work. And so I just wanted to add that as we're thinking about the commons, it really does tie to us as individuals, and it ties to how we come together and sort of build these networks of mutual aid, support, and action together.
If I could comment on that, I think it's a really important observation, Julie. The no question, but these processes like urban renewal and widespread disinvestment in our cities, deindustrialization, they've traumatized so many people at all levels of society. So people are really at an individual level suffering, and they have also broken connections. So people are isolated and they're not in community with each other. So you might think that what we have to do is individual healing, but as a psychiatrist, I can tell you that's actually the slowest way to try to fix a problem, especially there's so many people. We don't have enough psychiatrists, psychologists, social workers. We don't have enough therapists. Everybody in the whole world would have to be a therapist to heal everybody in the whole world. It's impossible. So part of this is to acknowledge the individual level of the suffering, but then to say, can we invent ways to heal the whole collective? That also takes care of the individual so that they're in reciprocity. This is what my colleagues and I call collective recovery. This is the urgent need. Think about languishing. We're not talking about 100 people languishing. We're talking about half the population of the United States languishing. And they're languishing and flourishing at the same time. They don't know what they're doing. So we have to think, how do we heal this collectively? But the great thing about this is that this kind of collective recovery puts us on the path to well-being because people do it together and they understand the solidarity. And one of the things that I've been promoting is dancing in the streets over the summer. There's a lot of room on the streets, so people don't have to be close together, but they can be kind of in the crowd, not necessarily crowded together, but in a crowd and moving and hearing music and having that joy, what I call the joy of being in the madding crowd. Very, very essential. And we have discovered today that Alonzo will put together the playlist. So I think we're on the road.
Yeah. I think well put, collective recovery and the power of that. Thank you.
So we should probably open up to some questions from the wonderful folks that have joined us from all over the place. So if you have questions for the panel or concepts you'd like us to grapple with, please put them in the chat. There's a couple that have been in there already. One of them was really around this question of how do we in a narrative acknowledge things like an inequity? How do you, if economics are not, if we're not going to bolt on to an economic frame, how do we still include economics, economic plenty, economic inequity? How does that still get included in a well-being framework? Everyone want to take a crack at that?
I just realized I got a little distracted, so I'm
I'm happy to take a crack at it. So I think probably Jennifer and Alonzo are the real experts in the room on this. I think the issue is that the narratives have have, in a way, two parts. One part is the problem, and then the other part is the solution. A colleague of ours, who's Dr. Maricela Gomez, who's a Buddhist practitioner, studied with Thich Nhat Hanh for many years, talks about this as sort of applying the Four Noble Truths to our daily work, meaning that there's a path to suffering, and there's suffering, and there's a path to suffering. There's a path away from suffering. There's a not suffering and a path away from suffering. Sorry, I'm mixing those all four up. When we think about that, so the story has to be, how did we get in trouble? And then how do we get out of trouble? It has those two parts. You can't, I think, you could talk about well-being without talking about the two parts, but you can't talk about the situation in the United States without talking about the two parts. But what's important about situations is that languages have thousands of words for situations that take all that complexity and boil it down to one or two words. If I say the word kidnapping, there's a lot of complexity in a kidnapping, but we all basically know what's happening. So, sort of the question is not what's the whole narrative, but what's the situation, and can we name it? And that actually is a task that we all know how to do and we all can do. And if I were to say to everybody in the chat, put in the chat the word that you think names the situation of the United States and the world, everybody could do that.
Jennifer, you want to jump in?
Yeah, I was thinking about Mindy, the sort of naming of the situation, the naming of the state. I think, back on the languishing and flourishing, I think the languishing article picked up so much traction because it named it, right? So many people were like, oh my God, I've been feeling this for a year and I had no idea what it was called, right? So some of that definition of terms, it comes back to the collective, right? A lot of people in the chat are saying like, it's about feeling seen and feeling like how you actually feel matters, not just like, are you making stuff and making money and making the economy stronger, but like, are you crumbling as a person or flourishing as a person? I think, Eric, to your question about how we keep economics as part of a broader conception versus focusing on economics and sort of bolting on these nice to have pieces on the side. A lot of what we've been looking at is studies and message research about how people conceive of the economy, right? So there's all these narratives or all these metaphors about, is the economy a living thing? Is it a bucket that gets filled and replenished? Is it how do we talk about it? How do we tell people that the economy is constructed? It's not this force of nature that's organic, but like we built it and we can rebuild it. And it almost reminds me of conversations about public health over the years. Like, how do we define public health and get everybody to understand it? And is that the key, or is it just doing public health work and telling the stories and inviting people into being part of a collective movement toward public health? So I think with with economy, to me, it's about demonstrating that everyone has what they need. And part of having what you need is having the resources to be safe and stable in your home and your food and your family and your community having those resources, your nation having those resources. But having the resources and growth for growth's sake is where we get off on an economic narrative. And I think if it's more about individual people doing well and having the ability to create the futures they want, with a strong economy, personal and collective being one piece of that, we might be able to reframe that conversation.
Can I just pose a question to you, Jennifer? Just to link back to what Julie was saying and what I was commenting on. If you have a substantial portion of the population that's been traumatized, and to some extent by policies of the government. I'm for big government, but we also know that big government can have big policies that have traumatized people, right? So government has two faces. It's a Janus thing. So people have been traumatized by these things. So we have to, I believe as psychiatrists, you have to name that as part of. You can't talk about we want to get to well-being, but in order to do that, we who are traumatized must. I don't know if that's how you see narratives, but that's how I, as a social psychiatrist, see it.
Yeah, Mindy, I'll tie into that. There was a couple questions about vilification, and there is a really intentional narrative that's been planted about creating villains around justifying traumatization, around this construct of you need to fear these other folks who are undeserving or dangerous, et cetera. And whether we're talking about Barry Goldwater or Nixon, et cetera. There's a construct that's been used that really creates this idea that as an individual, you've got to get yours and you got to keep it from going to folks who are undeserving or who are dangerous, et cetera. And that justifies a lot of trauma and masks over trauma and blames people who have experienced the trauma and been traumatized by policies for their own trauma. And I'm curious because we're starting to hear some emerging narratives around saying there's a big lie behind all that narrative, and the need to counter that by not only calling out that there's a lie behind that narrative, but the idea of the benefit that we get from a standpoint of solidarity, by addressing those traumas that we all benefit. And yes, the people who've experienced the trauma the most need the most, but we're denying everybody by draining the commons of resources. And so I'm just curious to all of you in terms of if you've been seeing any play between the narratives of fear and division and blame versus the narratives of solidarity and the better together benefits narratives, and if you've seen any of those working.
I mean, the thing that strikes me, Eric, is again, sort of looking at the laboratory of the past year, how initially the better together narrative was so strong. Like, think of all of us out banging on pots and pans for healthcare workers and really appreciating for the first time everyone being affected. Now that was before all of the cracks in the system and disparities and like all the bigger stories started to come out. But for a moment, I think Alonzo, you said this, like for a moment, everybody around the world was facing the same fear and unknown and threat. And that was a remarkable moment of solidarity. I felt, I'm sure not everybody felt that, but so that sort of solidarity, better together, how can we get through this? We're all experiencing the same thing. I'd be interested actually to track across social media or news media coverage, like how quickly did those fear and division and blame narratives start to pop in, right? And where did those come from and who promoted those and sustained them? I can certainly see that as we got into masks. I can certainly see that as we've gotten into vaccines. But I'd be curious to track the movement of that and then sort of pulling out of COVID, looking at where do better together narratives sit and center and work versus fear, division, and blame. It's also making me think about the moral foundations theory of Jonathan Haidt and the kind of like loyalty narratives or sanctity and degradation narratives that we, sort of in-group thinking, if I'm going to protect my own self and forget the rest of you, that anchor so many of the individual responsibility and individual blame narratives.
Those are really helpful thoughts, Jennifer. But I think that the trauma piece is slightly different. I think it is. If we think about it, and here's where an equity lens becomes very helpful. The people who were most at risk in this almost immediately said, wait, we're at greater risk. And so are we all in this together? And when you think about, for example, in Queens, the places with the highest rates of deaths from COVID also have the least vaccinations in New York City. How did that persist? How did that inequity persist across this year? Why didn't we fix it? What's the intransigence in the system? The 400-year-old system, what's the intransigence there? And but everybody in the Rust Belt, every city in the Rust Belt that lost its economy, everybody was traumatized. So this becomes a nationwide thing of the various kinds of trauma that people have lived through. So you can't just have a better together narrative. We are better together, but you've got to arrive at that. But you've got to start with the kind of aches and pains and frustrations and anxiety about the status quo and what my father always used to call the man. The man is not on our side, I was raised to believe.
Right. And I think you can't be watching, the city of New York go under in its healthcare system and just hang on to this notion of better together as if that's just going to get us through. So I think, to your point, Mindy, it's really about, there's talk and there's walking of the talk, and there was just so much revealed all at once about the reality that for all the talk, here we were. And then so people, they protect and they move inward. So, I mean, I think we have to be real, and that's the work ahead. And, so I appreciate what you said.
And we've seen that playing out in current policy. We've done huge and many good things in terms of the stimulus, et cetera. And we bailed out lots of businesses and employers and organizations. But we had a moment of seeing how essential frontline workers were, but we were not able yet to change the federal minimum wage to a living wage. That got stripped out.
Yeah.
We'll save organizations, but not workers. There's a question in a couple of good questions in the chat, and one of them, which I think really ties into this discussion about the overall construct, our concept of what the purpose of society is, and that was, there's a question about intersectionality and how there's a lot of talk about it. It's a term that's used a lot and is seen as being important, but in terms of elevating it to create system-wide change that crosses movements, how can that be done? How does intersectionality and this work across marginalized communities and communities that are experiencing these impacts, how does that become real? And is that connected in to shifting to a well-being paradigm?
Well, yes. And I think it's what's really hard, because we're organized in very siloed ways. And yet, we live our lives in very interconnected ways. And so when you have, so this is the hard work. And this is why really the redesign, I think, that we really need to be thinking about and working towards needs to be both bottom up. It's not just about sort of a new solution that comes and is sort of policies that are sort of overlaid onto us. And it's also about the interconnection. So it is about, we've seen our schools. Just looking at what families have gone through as schools have closed, and talk about the commons. This has been this is another huge trauma that people who have been trying to keep their work together and worry about their kids and these precious developmental years that kids go through that have, people were on their own. And so here so again, sort of seeing, I almost think part of what needs to happen is we need to give ourselves some space to really go a little deeper and put together some meaning making about what we've seen and been through, because I think, we all want to have a kind of a quick answer, but I think we also know that when you're flooded, and back to the trauma as a metaphor, to the extent that collectively we've been going through this, it's almost like we need to collectively step back and really look at these interconnections. Law enforcement is a perfect example. I'm thinking about how, in communities across the country, we're beginning to have long overdue discussion about the role of law enforcement. And yet it's so clear, if you don't have your mental health system and your community psychiatrists and community resources really set up, now what? So, this is a real reckoning. And I think we're on our way, but we're going to have to be careful to not just sort of shoehorn in quick, easy answers that don't ultimately address that interconnectedness.
And I love that thought, Julie. And I want to share in the chat a link to a website my team made. My colleagues and I worked on a call to organizations to observe the anniversary of Jamestown in 2019. So people across the country did this. And thanks, Alonzo, to Robert Wood Johnson Foundation for support to go back and talk to the communities about what they did and what they thought it meant. And we've just put together this website called A Call Answered. .org. And the reason it's important to your point, Julie, is that you can see communities doing what you're saying. Let's pause for a second and reflect on what we've been through and what does it mean. I think that that's really profoundly important right now. Every organization that can possibly do it, every group that can do it should, because so much has happened and it's so painful. And you know, think about India. You know, pretty much everybody in the United States is connected to somebody in India. And so how do we process that? Terrifying. And is it gonna come back and have us have another wave? What's gonna happen? It's very scary. So this opportunity to reflect is amazing and beautiful work that these organizations did, which you can see on the website.
There's another, it's a comment that's in the chat, but I'm going to throw it out as a question. There's a comment around the responsibility of government to advance well-being, and have we set the bar too low? Have our expectations of government been too low? And Mindy did a great job of teeing up this idea that there's government policies that have caused lots of trauma, and there also can be government policies that not only can address trauma, but actually could build public good. So question, I guess, from the chat around, have we set the bar too low for government? And maybe each of you could do a comment around where should we be setting the bar? How can government be a part of the solution in this work?
It's making me think about some work that we've been doing to understand how to talk to policymakers about the role of policy in creating and upholding structural racism. Even policies that on their face are intended to advance equity often don't. Exclusion of menthol cigarettes from flavor bans, for example, is one of those. And then also to illustrate how policies written well can start to rebuild racial equity. And I think one problem is how little policy is understood. One thing that gave me a little hope through COVID is more discussion of systems and policies and the way things like that build a nation and build connectivity or not, and build, you know, collective relief or not, or exacerbate trauma or not. I was just thinking, Eric, when you asked that, the question that I've asked you a million times in this conversation about how does this pull out of being another partisan debate, and how does this become more collective? And so the role of government is a partisan debate, right? Big government, too big in my business, versus I love big government and go Biden administration for bringing everything back. But I wonder if there's something about the role of government that's really about talking about the role of policy and the situations we create in community that create opportunity for connection and for living a full and thriving life and creating the future that you want.
Alonzo, you look like you were going to jump.
You know, as the former longtime governmental official on the panel, I mean, I was thinking about this, and I'm thinking about, you know, the potential that more local forms of government, and, you know, government isn't a monolith, right? And different forms do different things. And good community connected local government can do innovation, and they can do healing. They, you know, and we've seen examples about that through COVID and other kinds of things. They're good local governments have taken on healing and racial justice initiatives that are governmentally sponsored and trying to be part of the issue in certain places. You know, so there is something about the kinds of governing that is more proximate to community that has some hope. But then we also saw, and again, not to always be the negative voice here, states preempting localities from doing things for the common good, like enforcing mask mandates, you know, so, and in other areas. So preemption, as we talk about in the States, is a way that the ideology of a more distant form of governance intrudes on that part of government more connected. So but I do think, I think some things are possible around governance, the more local it is, because it's more proximate and it often has a more direct engagement and often more direct responsiveness at that level, city, county, variable, but, you know, a very different kind of thing than big P policy Jennifer, that you're talking about. I mean, just another reference on, this commons issue, what stands in the way of commons and what we have to address. If anyone has not had a chance to think about the book called The Sum of Us, What Racism Cost Everyone and How We Can Prosper Together by Heather McGhee, she uses one example that shows how challenging the commons is. And I'll tell the story really quickly. All right, so before the Civil Rights Acts, there were segregated swimming pools in communities in the 50s, even in the 60s. And then more enforcement of that and getting rid of Jim Crow. So you couldn't have a segregated pool in a community anymore. So what did some communities do? Well, they closed all the pools so that they did not have to have integrated swimming. That historically shows how deep the problem is around racism as a challenge to collective thinking. That you would close a community commons asset because of that. Her book gets more positive at the end, and she builds on that. So I know her and her mom, so I want to encourage you to read Heather's book because she builds on that with a very positive vision of how we can have a more collective spirit around around countering structural racism as not just somebody else's problem, but all of our problem. I hope I did justice to my brief synopsis of my colleague Heather's book.
Yeah, it's a phenomenal book and definitely very much articulates the case for shifting the paradigm of core expectation to a more sum of us view versus a zero sum view. You know, Alonzo, I think this is one of those both and places where I love what you're saying about local governance. And I'm also going to tie back to the comment in the chat about let's not set the bar too low, because there are places where we look at the things that we assume are the way they are were all created and baked in as policy. So we tax the work, what people earn with the work they do, radically different than we tax the gains people make on capital. And that drives, the resources that are available, whether we're talking about pools or not. We have a debate about infrastructure, and I agree with Mindy. Our bridges, our roads, et cetera, are in critical need, but we're having a debate about what's real infrastructure because we're not necessarily, we still live in a country where we do not fund parental leave for people that are having kids. We don't fund childcare. We don't fund elder care, et cetera. And some of those are local issues. And we don't have a construct nationally that sets a bar of expectation of, what people will earn for working full time, what people can expect in terms of caring for our children and our elders that are critical infrastructure. And I think that we've ended up in this false dichotomy debate that's framed around this normative expectation.
Yeah, I mean, this is, as I'm thinking about government and, federal, state, local, and what belongs where, I think, there's one would hope that there's some kind of universal agreements. I'm thinking about some law enforcement examples that are coming up, chokehold bans and just basic humanity. You'd think that there would be some national standards that could be agreed to. And so, what belongs at what level, I think is an important question and continued discussion. And yet locally, things emerge out of the creativity and the wisdom of community. And I think we have to really trust and value that, right? So, one of the things that local government can do that can't happen with other levels of government is this much more, dare I say, intimate or direct level of engagement and creating opportunities. So things like participatory budgeting, deconstructing the meaning of policy. How does policy affect one's life? I mean, some of what we learned in work we've done in Santa Monica around taking constructs of well-being and using them in things like land use policy, what a zoning ordinances and land use policies, as we know, really affect day-to-day life for people. And how do we see our responsibility as government leaders, as NGO leaders, as researchers and academicians to have things make sense and connect with people, because there really is a power. There's resources, there's levers that can be used, and I think we've got to be more sort of direct about that and creative in how we kind of use the different levels of government.
So I want to shift us, because we're coming up here towards the end of this conversation, which I hope is not the end of a conversation, but is sparking for lots of folks that have joined us, continuation of the conversation. But I'd love to take just a couple minutes each, as we've been listening to each other and seeing the wonderful suggestions and comments and good resources being put in the chat, for each of us, just to share out a few parting thoughts for a couple of minutes. I'm going to suggest that we kind of reverse the order. So maybe Jennifer, then pass it to Julie, to Alonzo, and then Mindy, and I'll bring us home.
Thanks, Eric. This conversation is great just to fuel my own thinking about narrative and some of the questions that we've been thinking about, and some new questions that you're raising. I think I'm hearing in some of the comments from my fellow panelists and in the chat, this really strong opportunity for a strong and shared narrative that centers well-being as our definition and pursuit of progress. And John, you just asked in the chat, like, the key question: if well-being is to be the North Star, what is the compelling language that is easily communicated leading to action? I wish I could answer that. I'd be really would have earned my money from my whole salary. And here I go on money, right? It is the question. It is the question. And there's a huge opportunity for learning from all the various people who have been trying to answer that question and trying out different things. And testing what works. There's so many threads emerging today. The stockpile metaphor, connectivity, trauma, both shared and isolated and individual, the role of the economy, intersectionality, like all of these things play into what that narrative could be. And if we could get to a shared narrative, everybody doesn't have to say the same thing. We just need a shared meta narrative that's moving us in that direction, that all the different social movements and issues could play with under that. That we would start to envision and expect and demand this kind of alternate future that's about hope and opportunity and connection and equity, that would really propel all these movements forward. It sounds fantastical. I believe it is possible. It just is going to require some concerted effort to bring together a lot of isolated attempts to understand what could really work and anchor it. Julie.
I think I really am I am continuing to think about this question of making meaning out of the moment that we're in. And I do think that some amount of reflection and stillness with urgency is one of the challenges that I feel that we're all facing, because certainly as we kind of reemerge, the tendency is going to be to want to have some quick wins and easy answers. And you can't have downtowns that have been gutted because storefronts are empty, and just the sort of brokenness and struggle that people are experiencing without a real net effect that's troubling. So the question of where there's opportunities, I think in our workplaces, I was really participated in something some of you were involved in this last week with colleagues in Madison, Wisconsin, and heard about a company there, Promega, that is really thinking about the well-being of its workforce in a very thoughtful and well-embedded way. And I can't help but imagine that the people in that one system will be hopefully have tools and resources, not only in their work, but in their lives and in their community. So I think this idea of looking for the really strong, deep examples of how we kind of apply the research and the knowledge is incredibly important. I also really find that as we're kind of learning from each other in other parts of the world and thinking about what's sort of happening at national government levels and local government levels, the opportunity to share stories and connect is incredibly powerful. I want to give a shout out to the work of the Wellbeing Economy Alliance. I know there's a number of folks on the call here today that are working there. And I think they and we together really are thinking about how to not have sort of while it centers in thinking about economy, I think it really is about economy in service of humanity and planet, not us in service of an economy. And I think that shift is a really important one. So I think there are a lot of bright spots, and I would really encourage those of you who are in research and academic spaces to really find ways to partner with people in local communities, because I do think examples that are coming out of the creativity and the wisdom of community movements and action are really important to pay attention to and lift up. So thank you for the opportunity to be part of this today.
Great, yeah, wonderful, really wonderful to be with this group in the Zoom context of being with, which is what we have now, and we aspire for more soon. And I guess, I love the North Star analogy, because like, what did the ancients use the North Star for? Right, they used it to triangulate navigation to get to where they were going. And why we might need a new North Star is to examine where we are. And we are not. COVID told us, George Floyd's murder told us, climate change denial tells us, many things are telling us that we are not collectively, we're not where we need to be from many different assessments. And let's maybe, and there's so much creative thinking about well-being, why not try a different North Star? Try a little different societal navigation route. Look a little more closely at, and we have folks on the call here, countries who have used that as more of a North Star, and what have they been able to achieve and how? So again, I think it does come from, this conversation reflects it, some recognition of where we are, the trauma, to Mindy's point, to trauma where we are, and all paths to get out of trauma deal with recognition and healing, and then change. And then I think it's the evidence shows to people experientially that I think we'd like to be someplace different. Well-being seems like a great navigational device.
I think that Jennifer said we want to center the well-being narrative, and I think that's the wrong way to look at it to set up the problem. I think the North Star is better. Because if you say we want to make well-being the North Star, which was what was on the invitation, that's better, because think about Harriet Tubman, who we all want to have on the $20 bill, or at least I want to have on the $20 bill. She was going by the North Star, right? So all those people who escaped to freedom were going by the North Star. So if well-being is our North Star, what's our starting point? That's where we want to go, but here we are. And then I think you encompass everything that we've talked about today, this sort of, can you have a pause? I hope all of you get to look at the website, A Call Answered, and look at the work of the National Organization of Minority Architects, which convened with some children from the local Brownsville community and went to the Weeksville Heritage Center, an incredibly beautiful and important site in African American history. And at one point, they're doing this 5 census scavenger hunt, and they all pause and they face the sun. It's an extraordinary moment, and it's one of those moments of they're in the space of history, they're talking about the history, and they're all together looking at the sun. That's really collective healing. It's that pause that Julie's talking about. We all need that pause. And saying at this particular moment, what well-being means is that we pause. And so the well-being collectives and all the people who are promoting this say, let's figure out whoever will show up to pause. That will bring some calm and some love into the conversation that's badly needed right now. And I think from that space, people can speak more coherently. probably one of the most important quotes to us was Dean Sandro Galea of the Boston University School of Public Health, who said that observing the anniversary in 2019 prepared the School of Public Health to think about COVID. And we need that preparation. So the observance of the past year prepares us, it gives us tools, it gives us calm to think about following the path to the North Star. It's a long path, and so we can't center wellness. We want to get to wellness, but the process of getting to wellness is how we get well.
Well put, Mindy.
Thank you all for such a great conversation, great insights, and we're seeing a lot of folks who have joined us, not only commenting on the enjoyment of the conversation, but hoping the conversation continues and sharing links to their work, which is just wonderful. A few takeaways that I want to share is we've really heard a lot of this conversation about the need to value the commons, the need to, again, and so if well-being is the North Star, one of the pathways towards that North Star might be reinvesting in the valuing of the commons and looking at how in our policies and our actions we are reinvesting in the commons, not only the physical infrastructure of the commons, but the human infrastructure. There's been a lot of conversation about debunking the myth of zero sum is how the world works, and really questioning that and looking at the places where there is benefit delivered by solidarity, and where this pandemic that we are in, that every panelist has mentioned has been responded in the comments in the chat, has shown us so incredibly clearly how we don't have silos and walls and barriers, that we are in this this same situation. Really recognizing and seeing the trauma that has been experienced and healing that trauma, looking at the places where changes need to be done to make things more right than they have been, and to address the real harms that have been done has been an incredible part of this conversation. Setting the bar higher. Mindy just talked about, hey, that's a big north, that's a far away North Star, and we got to start where we are now and recognize it. But also, there's a lot of conversation about setting the bar higher for ourselves as people, for our organizations and institutions, and for our governments. The nimble discussion about the power of local government and the importance of looking at things that are on a national and an international scale and not shying away from setting that bar. There's been a lot of discussion about meaning making. Mindy just gave an example about the power of that moment where folks turn towards the sun. Julie talked about taking a pause and making sure that we are understanding and reflecting on what we've been through and looking at what's the meaning that we learn from it. At the beginning of the conversation, we were talking about how some of the folks that have been really advancing this work are artists and culture makers. I see in the chat Lulani from the Native Arts and Culture Foundation talking about the need to bring happiness in as a part of this, and to take a look at the meaning making that is happening, and then to turn that meaning making into action. I loved the comments that were being made about the need for reflection with urgency. And then as we talked about, John asked the question in the chat about, well, what's the language, what's the framing? And the language and the framing does matter. And a place that we can all be trying some things on is looking at how do we get out of an economy plus framing? How do we move from saying we've got an economy and growth overall construct to we're going to have a better economy or a more fair economy or a more equitable economy construct, to really trying on ways of talking about we're going to have a humanity construct, a doing well construct, a thriving commons construct, of which an economy is a part of it. And finally, a thing that I'm taking away from this is really the ability that we all have and the need that we all have to really question and reset the definition of progress. There's been a couple places in the conversation. Jennifer brought up this question of, well, how is this different than just falling into the same traps of partisanship, and it's about big government or not? And I guess I would take us to a place of moving upstream from that, of the reason we are in the discourse we are nationally about big government versus small government. It isn't by accident. That was a construct that was put forward as a way of advancing a reactionary economics theory that benefited a very small group of folks with extreme benefit, and took it from the commons and took it from everybody else, and caused a lot of trauma. And so I think one of the things we're hearing today is an inspiration to say, we don't have to accept that as the way things are. We can question that and move upstream and say, we're not buying that as the way things are. We're not buying this as a liberal or conservative or progressive or big government trap. We're looking at this as what we need to do to advance the North Star that's best for all of us. So really inspired by what we've been hearing today. I'm seeing lots of folks in the chat talking about wanting to look at ways to continue the conversation. And certainly if you want to continue the conversation, I know we're all interested in doing so. So we put the email up on the slide. We'll put it up again, where if you want to stay in touch, you can, and we'll make sure that we share that with the other panelists so that folks can be connected. We'll be sending an email out to all of you with a link to the recording of this session. So if there's something someone said that you really want to make sure that you capture, that will be available, of course, for everybody, and we'll get that out probably tomorrow. So we'll do it soon so it doesn't get lost in all of your inboxes. Again, I really want to thank this incredible panel for taking their time and their energy, and more importantly, for their work that they've been doing. I want to thank the people that have joined us. Looking at the participants list, it's a set of people that are thinkers, activists, leaders, and culture makers. So thank you all for joining us, and let's advance a new North Star. It's a long path, but together we can do it. With that, it's the top of the hour, and I think it's time we adjourn. Thank you.
Thank you.